treated, racial disparities in the criminal justice system in the US. And so thank you so much, Dr. Klein, for coming down and really looking forward to your talk. So,
thank you so much for having me. And I hear that this is the first of these seminars here, so hopefully this gets off to a bang. I am really sad that you don't get to meet Brennan, who is bummed to not be here. I sent him a text saying, do you want I said anything that you want me to slip into this talk, any like propaganda or anything, other than learning everything from me? No. So yes, so as the introduction alluded to, I think a lot of what I do now is something that I would say is very interdisciplinary, but I think me several months ago didn't know what that word meant. So this is largely the core group of people that worked on the paper that I'm going to discuss today. So Brennan and Sam both come from a more epi public health complex background. Elizabeth Hinton and her student Ben Schaefer are historians and legal scholars at Yale University. Emily Wong is also at Yale. She's a physician and a public health researcher who really specializes in this question of public health and mass incarceration. Tina Eliassi-Rod is a computer scientist who looks at like algorithmic fairness and the effects of unintended sometimes rhythms. And then there's just a team of data scientists on this project. And so what I'm going to hopefully show is that like everyone is the main character at some point in this story. And so and really I think that's how at least this team thinks about interdisciplinarity. And so I'm really excited to share it with you today. Just quick about me, my background's in cognitive science. I got my PhD in network science, and I'm now at Northeastern, which is where I've been for the past 8 years doing network science that has turned largely more and more into thinking about a network public health, and especially in the context of the criminal legal system. Okay. So today's talk, one thing, if you've ever seen a talk of mine, which probably none of you have, I always put these like as tables of contents in. It probably won't resemble what this talk here is, but it's nice to have goals. A quick note on just language and different contexts of people coming into on mass incarceration. This is especially relevant, or this work is especially relevant in U.S. context, in particular because of our pervasive system of mass incarceration. And so my language will be primarily U.S. centric, although there's probably other ways to discuss this. The other thing that I think people maybe unfamiliar with the criminal legal system often conflate is that prisons and jails are, I guess I'm saying this in Rhode Island where this is a caveat, but prisons and jails are typically two different systems. Prisons are facilities under state or federal control where people serve a sentence after they've been convicted. In jails, typically most people have not been convicted of a sentence. Today's work is going to focus mostly on state prison systems. And I think another thing that we don't have a good sense of typically is just the scale of mass incarceration in the US. So there's three different plots here. On the far left, you can see the per capita incarceration rate compared to other OECD countries. The US tops it. Compared to every country, the US tops it. If you break it down by state, like the states top the list of most incarcerated regions in the world. There's 20% of the world's incarcerated population, despite having only 5% total population in the US. And I think the key thing that people think about in mass incarceration in general is this pervasive and long-standing inequity, especially along lines of race. So Black people make up 13% of the total US population, but comprise over 38% of the incarcerated population. This leads to drastically disproportionate incarceration rates. And there's work, and I've started to follow up on this quite a bit, where after controlling for what's called similarly situated incarcerated people, on average, Black people are serving 20% longer time. And this will be a key thing that I'm going to keep coming back to as a really important, I would say, driver of the results that you're going to see. And in some way, like the whole paper that we we wrote was just a reflection of this statistic. And it's also more and more, and this I think is encouraging, especially for folks in this room, to kind of put all of our minds together on this, is that mass incarceration is more and more being thought of as a crisis in public health, and as not just like a byproduct or a related problem, but fundamental to our notion of community health. And so there's also faster, but there's experiencing incarceration is disproportionately associated with poor health. These often have also indirect consequences to families and children associated with incarcerated family members. This is a problem of community health. So if you think about disease transmission within and outside of carceral settings, again, there's racial health disparities that pervade this as well. And some commentators, and including some of the co-authors on the work that we did, really think of our country's lagging performance on health indicators as being tied to mass incarceration per se. So my own entry into this work came from a couple of years of doing a lot of disease modeling, especially around the COVID-19 pandemic. So I didn't realize Dan was maybe in the audience, but shout out to co-author some of this stuff. But I was looking more and more at transmission of the disease within congregate settings, and especially congregate settings that are associated with unequal outcomes. So we had work on eviction moratoria, or looking at transmission within schools, or byproducts of infections among college towns. And it kind of hit us relatively early on that prisons are a devastating mix of these two things, where there's highly dense populations of individuals and also highly unequal outcomes typically. Just to give you a sense of what the scale of that is, this is not work from us, but it's terrific work to lay the land here. So the death rate from COVID-19 of people incarcerated was 2.5 times that of the general population. If you go to Florida in particular, the mortality rate was around 4.5 times the state, which had the effect of decreasing the lifespan of incarcerated people by about 4 years on average. And in a sense, you can ask yourself, like, well, shouldn't we have known that these highly dense carceral settings are really devastating grounds for disease transmission? And this one thing that's useful about working with historians is going to the archives a lot. So this is this great picture of this is the New York State Prisons annual report from fiscal year 1919. It's also pandemic. But this line right here from the physician's report, owing to rigid enforcement by you of the quarantine regulations during the influenza pandemic, only one case of the disease developed in prison and the patient recovered. Now, this is historical records from a prison system, so your mileage may vary on what level of credulity to give to this, but at least we knew the measures involved in actually mitigating spread and devastation of the virus. So hopefully that's like a whirlwind.
I'm having trouble hearing you on Zoom. Sorry to interrupt the. Not decidedly not a microphone.
Can people hear that on Zoom?
Yes.
All right. Maybe we'll just.
There's no batteries in this. But that might, they can?
Yeah.
Okay. So the mic seems like a good.
This is work. That works.
Yeah.
Sounds good.
Okay. Cool.
Sorry about that.
Okay. Yeah. Sorry for the last 10 minutes. Hopefully people.
We liked it.
I'm gonna try to. So I'm sorry. People in the chat, can you hear if I don't hold the microphone? Wonderful. Okay. Yes. Okay. A cascade of yeses have come in, so we can go on. So what I hope was that was a sort of way too quick and overlooking way too many complications, but an okay introduction to the state of mass incarceration and public health in the US, and especially how COVID, or basically what COVID had to come into. And so with that, I want to go into the paper, and I think there's a couple ways of thinking about what we did here. The one thing is just we just made a big data set and wrote about it, so that's the maybe as someone who's more data inclined myself, that's what I typically think of with this. But it's probably a good place to start. So what we did was we collected monthly counts of the number of people incarcerated in every state and federal prison system. And we also have this information separated by race. And I will get into a little bit of an interlude about the data collection process, because I think for people, especially in public health, this is maybe like a therapy session, but also like also informative just for, I learned a lot in thinking about public information and how to access the data that is ours. And so just to tease what the data showed, and remember, I came into this work in a very disease modeling, COVID-19 modeling context. And so what we were thinking about doing was quantifying impact of COVID among incarcerated populations. And if you kind of think through what's required for this, if you want to calculate like an infection rate, you need denominators. So you just need to know how many people are actually in prison. And the thing that is in retrospect not shocking, but at the time was like shocking and infuriating, is that there's no place to go to get basically up-to-date information on the number of people incarcerated in state prisons and separated out by race. And so part of the actual groundwork in this study was to construct this data set ourselves using a series of Freedom of Information Act requests, some maybe sketchy scraping behavior. But what this did was we started to look more and more at the actual data that we're collecting. We started to realize that it's not actually our story to tell about infections and prisons. It's just something about the criminal legal system. Or we decided to basically tell a story about what was happening to the criminal legal system during the pandemic. And you'll see why this sort of jumped out at us. Their thing to discuss. I'm going to show you two plots here and kind of build this up. But on the left, it's just the total nationwide incarcerated population at in-state prisons over time. And on the right, it's the percent of the incarcerated population who are Black. And so about a decade before the pandemic, there was a steady decrease in the total number of people incarcerated. This corresponded to a also somewhat steady, like monotonic decrease in percentage of incarcerated people who are Black. And then, I mean, I think we've all seen enough of this like March 2020 vertical line on a plot kind of things, but clearly something happens right here. And you see the largest and fastest decline in the US prison population in its history. And amid the decline, you see a large increase in the percent of incarcerated people who are Black. And when I say large, you can maybe look at the vertical axis and say like, yeah, it's a couple of like decimals of a percentage point. But if you kind of think about the context of mass incarceration in the US, these are enormous populations that are slowly varying over time. So you never see anything this abrupt in any of these time series. So this is a blip that it seems like is characteristic of the system itself. And if you want to get down to actual like calculating counterfactual differences around if, let's say, white incarcerated people and Black incarcerated people had the same outcomes, this is roughly around 10 to 12,000 more people in prison than you would expect were there similar treatments. We saw this in the data, and you naturally asked why. And just a quick note too, this is aggregated at the nationwide level. We see this in pretty much every state, and it may manifest differently. So there may be basically an increase and then a larger increase or or a decrease and an increase, but more or less, this is just this robust phenomenon hold the microphone. Okay, more or less, this is this robust phenomenon that you see across every state. I won't go into too much of this plot, but this is information just laid out incomprehensibly. Okay, so the question that we were asking is what might be driving this trend, number one, and number two, how would we know? And while the mechanism may have likely varied state by state, the actual like fundamental gears that were involved in this could come in one of two forms. So number one, if we see this new introduction of disproportionality in the time series of incarcerated populations, this could be due to new statistical biases and who's being admitted into prisons. It could also be bias in who's being released from prisons or some combination of both. I'm going to bookmark this here and talk about something that for some people, maybe like 20%, is going to be very exciting. 80% of people can take a quick nap. But just to give you a sense of what this actually looks like on the ground is more or less, we have a text thread among the authors, and I would just send them updates of like, we got Maryland, or we got, and so this would just be updated and updated as we started to wait for different Freedom of Information Act requests to come in. And I'll give you a couple of examples of the types of the sort of these would be paragons of open data. So, so a couple of strategies that we use to collect some of this data in the hopes that actually it's useful, just not in the context of collecting population data of people in prison, but you can think of other public health data that could be collected this way. So one example is Alabama. Alabama on their Department of Corrections website has this little table with this note that says historical data is not available online at the time. Does anyone know why it actually is? Has anyone heard of this website? This is the Wayback Machine. Should win the Nobel Peace Prize. It just stores previous builds of websites, and you can access what used to be on the web page. So what you can do with this is write like you can see previous iterations of the website. You write what appears to be 20 lines of bad Python code that could be done in like 3. And you can get basically the total incarcerated population over time just through this process, and also the percent of incarcerated people who are Black. So that's one example. You can kind of skirt what they don't realize they are doing, which is creating records of their data that we can access. And this turns out to be like a little 10-minute process. In some sense, this is the easy case. Georgia, another easy case actually. Georgia produces monthly PDFs of what they call an inmate profile, and PDFs through a Python or R package called Tabula are quite easy to scrape and automate the collection of data from. So just a quick note on Tabula also, I'm a huge fan. If you have PDF data that you're like, I could either manually take what's in this cell, in this table, in this PDF, and put it into my data set, you just use Tabula to put evangelist on Tabula. But this is an example of the table of contents of what Georgia produces every month. And again, with a third of this code, you could do exactly the same task. And what it does is it makes just quite a bit of really detailed data about Georgia. So we know a lot about the incarcerated population of Georgia over time, and with pretty regular. Just a side note about Georgia Department of Corrections is that there's actually quite a bit more interesting and problematic work to be done looking at this. So there's a concerning scope of data that's collected. So you see on the left, there's like religious affiliation, there's IQ scores, there's heights of people. And I've been sort of shopping this around to colleagues to see what their takes on this. And there's a bunch of people who just like see this as the legacy of Genesis ideals in carceral settings. A couple of people have said, well, this is actually useful for thinking about education in carceral settings. I'm typically weirded out by this, but just an example. There's also, I don't know if you see there's a lot of like health information in there too, so HIV status, etc. Okay, another quick one, and then we're done with data, I promise. But Arizona is where I'm from. This is the Arizona Department of Corrections website. They have a thing called ethnic distribution by unit. These are the races that Arizona classifies people incarcerated as. I don't know if you can see it, but it's total, Caucasian, African American, Native American, Mexican American, Mexican national, and other. This didn't have enough PDFs for me to use the Wayback Machine, so I'm sad. But what they do have is one of those websites that increments people by an ID number that increments by one. So what you can do essentially is briefly this, but you can, in theory, get the entire database of everyone ever in contact with the criminal legal system in Arizona since like 1914, which is when it was around. So there are some websites where you can just uncover in a worrying way, uncover the false. One random, just fun fact. So this is from the Department of Corrections in Iowa. Good morning, Brennan. Attached is the information you're seeking, the FOIA request. This is like, couldn't design a better troll. So this is an Excel file. On the bottom, there's different tabs for different years. All of these are different tables. All of those tables are PNGs of the tables. So it's just images of the data that I want. But at least they get it. I send a nice email back with the CSV attached. Okay, end of intermission. So again, we're trying to figure out, basically, there's two main mechanisms that this come from, or at least two families of mechanisms. And just to cultivate this intuition a little bit, if you think about a time series like this, where the number of incarcerated people is on the vertical axis, it's on the horizontal axis, in order for this type of trend, where basically a flat time series to happen, you roughly need admissions and releases to be equivalent, right? So you can think about deviations to that as what influences the shape of the time series. So if you have some flat time series and then suddenly there's a big increase in the number of people incarcerated, that could either be their steady admissions and then a reduced number of releases from prison. It could be that there's increased admissions and steady releases, or some combination of both. Likewise, if you have a decreasing population of people incarcerated, the opposite can be true. So we can kind of break this down by different ways that you would imagine biases in who's being either admitted or released from prison. And I won't go into all these equally, and some of them are, I guess, a little more complicated. We were trying to look for basically nationwide general processes that could play out, because we do find some interesting case studies where some of these factors are especially prevalent, but just not universally. So if we focus on potential biases in terms of who's getting admitted to prison, these could be due to court disruptions. Most courts, all courts except for one, were closed for at least a month. Many for much longer. This caused either virtual trials or an increase in plea deals that were offered and accepted. You can also think about changes in policing practices or the population of people who are being policed, or you can think about disruptions and transfers from local jails to prisons, or some combination of a lot of that. A lot of figures, but I'll walk through it. So we got interesting data from Florida looking at their court system. And essentially what we found is that during the March 2020 time period, fewer people got sent to court. Among those who were, their cases were resolved, 60% less than average. And then there was also this interesting large spike in the percent of cases that were dismissed pre-trial. And what we thought was, like, maybe we could correlate that big spike to like the next month's basically non-white incarcerated population. And there was quite a strong correlation there. We put it in the initial submission. The reviewers were like, that is pseudoscience, you can't just do that. But little did they know, I had a FOIA request into the Florida circuit courts and circuit criminal courts. And what I can only assume was accidental. They sent me the entire data set of everyone who had contact with the criminal legal system since 2018. And so this includes people who get arrested, go to court, and then get their charges dropped. And so this is just it's the one on the right is what I want to show you. Just the percent of defendants who are dismissed pre-trial who are white. If you just overlay it with the spike, it's essentially the same. I still didn't really make it into the paper, but it's just a spiteful validation. Another one that we thought quite a bit about and are now kind of turning into its own project because it's a little bit more nuanced than could make it into the paper, is thinking about how policing practices or the police population, people being policed during these March, April, May, June 2020 might have changed. So what there's also just interesting data to work with in general. Several states released bulk data about drivers involved in traffic stops from police officers. So we can use this data to ask whether there were changes in terms of who got pulled over in March 2020. So on the horizontal axis, just time. The vertical axis is the percent of drivers or traffic stops involving drivers who are Black or Latino. In this case, it's Texas. And so what you see basically right at March 2020 is a massive increase in this. It's about 10 to 15% increase. If you look at Connecticut, it's the same increase. California, same one. If you kind of overlay them and standardize it, you basically get the same magnitude of increase. And we thought quite a bit about this, and in a way, this reflects a system of other inequities across like both economic, both public health. So, I will let you all hypothesize what we think may be causing this, but in a sense, it really does reflect employment differences by race, reflects who is essential workers, who is driving their car and even eligible to be pulled over when everyone else is on Zoom, et cetera. The reason that this is also turning into its own story is that the reviewers hated it as well. Because, and they're not really wrong, I would say. Look, like I think traffic stops per se are not the thing driving the change in prison population. I would also say they're not in that they reflect patterns in arrests that you can probably, although this would need to be an empirical question, extrapolate to actual arrests. Yeah, I'm skipping over transfers from local jails, but so let's talk a little bit about bias and releases. And I think everyone kind of has a sense of what I mean when I say this, just based on like news stories at the time. So you can think about atypical releases from prison during this time period, where governors or head of parole boards would recommend the release of a large number of incarcerated people who fit certain criteria or are deemed I guess whatever their eligibility criteria is for being released. You can also think about typical termination of sentences. For this run-of-the-mill, someone has served their sentence and been released. There could be disruptions to that. There could be disruptions to sentencing policy, parole policy, et cetera. So we can do one sort of small case study on these de-densification, in my mind, prudent decarceration efforts in a state like Arkansas. And the short story of this is that despite accounting for 57% of the total incarcerated population, white people made up 70% of the group of people eligible for early COVID-based release. There's a lot to discuss here, and one of the reasons that we sort of don't discuss it that much in the work is that we think of these large-scale releases, like so I was surprised that Arkansas did this, for example, especially given that not many other states released that many people. We heard a lot of news stories about like, oh my God, this governor is going to release a lot of incarcerated people as a public health measure to de-densify prisons as a prudent response. Not a lot of that actually happened. Most states release nobody. And then this is where, so I hope that this is a sort of like Goldilocks kind of story where everything is, I think, suggestive of the types of trends that we would expect to see, but nothing has been the sort of punchline yet. And I think it took us about a year to wrap our heads around what this actually is. But I'll just kind of step back for a second and say, this figure, I guess there's reason to believe that we should have expected it, given what we know about mass incarceration in the US. And what I mean by that is, and this is a sort of like stats 101 kind of problem set question. But all I need to actually see this figure, all we need is two basic ingredients. One is that the overall prison population, overall people incarcerated, among that population, there needs to be a difference in the average time spent in prison by race. So that slide from before about how on average nationwide, Black incarcerated people are serving 20% longer sentences. We know that that baseline is there. The second thing you need is a sudden decline in prison admissions. And given those two things together, we're always going to see this some kind of some variant of this. Such that if I knew a given state's sentence length disparity, I knew how to quantify that, and I knew how much their admissions dropped at the start, I could tell you what this would look like. And the way to think about this is like another way of saying that there's differences in sentence length by race is that on any given day, someone being released from prison is that much more likely to be a white person being released. So you have this large decline in admissions, and then you have pretty run-of-the-mill releases that are disproportionately going to be white people. And this is what is driving these spikes. It's also what drives the reversion back down, because once admissions start to pick back up, this in a sense is a tempering force for these types of demographic changes in the population. So there's so I mean, there's a lot more that can't fit here that I would love to talk about. What I think I want to prioritize talking about though is this really interesting institute that I'm a part of. It's called the Institute on Policing, Incarceration, and Public Safety at the Hutchins Center for African and African American Research. And it's co-directed by Brennan Terry and Elizabeth Hinton, who Professor Terry is a political philosopher and professor in African American Studies and Social Studies. Elizabeth Hinton was formerly at Harvard, now she's at Yale, but she's a professor of history and African American Studies and professor at law at Yale Law School. The two of them started this institute with this vision of really having normative, historical, and data-centric responses to thinking about policing, incarceration, public safety. And in particular, just as a side note, like everyone on this project is either named Elizabeth or Brandon or Brennan. But Elizabeth Hinton and Elizabeth Ross, who's a PhD student working with Elizabeth Hinton, a couple of years ago wrote this paper called "The Discriminatory Purpose of the 1994 Crime Bill," and in a sense that's like I recently learned this is like technical jargon in legal settings. And what I want to focus on is, I can read this font. So this new frontier of historical research is not merely of academic interest. It has important implications for constitutional scholars and defense attorneys who can draw on these findings to challenge criminal statutes under the equal protectionist laws. So what we've been doing recently, and sort of picked up since the papers come out in like a fascinating and really overwhelming way, and part of the sneaky reason that I'm here giving this talk is that sort of recruiting, like I think we need a lot of help in some of these questions, but we have been working with federal public defenders, and especially their strategic litigations units. And these are people who, in general, public defenders, my father was a public defender, have very hard jobs In some federal districts, there's strategic litigation units where people can kind of sit back a little bit and take a broader view of what should we be focusing some attention on. And in particular, we're working with a couple that are around federal statutes that they think and sort of based on their experience with trying a bunch of these cases are very much racially disproportionately applied and are under statutes that were birthed out of discriminatory intent. And those two ingredients, disparate impact and discriminatory intent, are the ingredients for doing what's often referred to as these Arlington Heights challenges. This is an example where a law was proven to be violating the Equal Protections Clause because you had data people showing that it had disparate impact. You had historians arguing as like expert witnesses for the discriminatory intent behind the passage of the law. And we're starting to build out projects that are doing this strategy. So we're like, it's the most terrifying thing, but like signing a declaration of like a statistician's report. It's like level of scrutiny on the code. And so there's a couple promising, I think, either legal routes or sort of a drum roll of public support along issues that we feel passionately are discriminatory or have disparate impact. So one is a recent grant that we just received about from the Robert Wood Johnson Foundation under they did a call about data visualizations of structural racism in place. And I think everyone's probably heard of drug-free school zone laws. These are laws that originated in the 70s where the idea was like, we don't want people selling or possessing drugs in schools. And they've sort of morphed into not just schools, but larger just issues of place. So parks, for example, public housing projects, churches, all of these are depending on the state, places where if you are charged with a drug-related offense in these in some radius, you have an automatic amplification to your sentence length. And so recall from before, the two characteristics of US mass incarceration is racial disproportionality and people serve very long sentences. So this is one mechanism where sentence lengths are automatically increased. And if you actually look at, if you just think for a second, so getting ahead of myself. These are a couple states that have maybe good examples of how these are applied. So in Colorado, selling drugs within 1,000 feet of a public housing project will face an increased sentence from between 8 and 32 years on top of their original sentence. Or drug possession in Arkansas, 1,000 feet of a church, mandatory minimum 10 years additional. Or in Alabama, selling drugs within 3 miles of a school, there is an automatic 5-year increase to someone's sentence. And if you just think about this spatially, like where is there a park, where is there a public housing project, where is there a school? If you think about a city and you draw any sort of radius around these locations of interest, you suddenly have, and this is a garbage visualization, I apologize, but you just have this complete coverage basically. And if you think about the racialized spatial nature of cities in the US, then you kind of have a sense of this sort of small, like maybe well-intentioned 1970s push that sort of grew way out of its original intent, that then gets you Alabama that looks like this, which in terms of population centers, very few people are not eligible for these drug enhancements. This is just the same slide, but in a random spot in Massachusetts. Massachusetts has a relatively small radius of like 300 feet. There's pushes across the country to get these down to just like the boundaries of the school, for example, and only include schools. The public housing bit is a little bit like on its face, just not good. And then if you also think about, this is part of the endeavor of the whole project that I was describing today is that we just are sort of hoovering up as much data about every state's carceral system. And so we can ask questions when we have some idea about what's the effect of drug-free zone laws in, let's say, Florida. now we just have data about this over time, bulk data, gigabytes and gigabytes of data. And so we can say, okay, what's the overall population of people incarcerated in Florida as of April 1st? That's the dark gray bar. If you look at Black people and white people in Florida prisons, and if you look at those who have drug-free zone law convictions, it is, I guess, statistically significantly compelling to put in front of a judge who is adjudicating some of these things. That's sort of the longer term legal strategy behind this. And it doesn't just have to be in a courtroom, it can also just be data visualizations and stuff for the public to sort of drum up some public support to start trying to influence lawmakers directly. So that's the Institute. We're very new, it's about a year old, and the thing I want to just come back to is that we often have events on campus that are public. So speaking from someone who just took the training today, it's like an hour to Boston. And I really encourage you all to come. That's it for me today. I'm around for the next several hours if anyone wants to talk. The paper's there, and there's more data and stuff on our website. Thank you all for your time.
About 10 to 15 minutes for some questions.
Thank you very much for your talk. I'd just like to ask two brief questions. One, have you accessed data from the 1990 flu epidemic to see how it impacted people that were in prison? And the second question is, in terms of category, in the state of New York or Florida, I'm just wondering how many people from the Caribbean are being lumped in the Black category, as opposed to making another.
Yeah. No, so two really good questions. So the first was about actually accessing data from 1918, 1920 in prisons. So I don't have counts data from infections within prisons, but this is a little tangential. One project that we have at the Network Science Institute at Northeastern is so our big global epidemic metapopulation modeling software is called Klein. And there's a push to make ancient Klein, so you can look at like bubonic plague, and the case study is originally around 1918 influenza pandemics. So in theory, some of that could be computationally done, and there's error bars everywhere, but that's one interesting development. The other point is that part of the data collection effort, and this is it's not a short-term thing, but we want this data for all of history. All of US history. So one of the things that, and this just requires people and a sort of intuition about where to look, and but I think it's possible, and we're trying hard to get that. So we could actually find some route into this question.
Which means that I could go to Bridgewater State Prison, Bridgewater, Massachusetts. If I could go that hypothetically, could they tell me how many prisoners died from the flu from 1918 to 1919? Would they have records of that? Would they be just 100 deaths? As opposed to all of that.
Yes, so I don't know for Massachusetts in particular. I know that in New Jersey and New York and a couple others, they would basically release yearly reports of everything. There would be a whole section on the medical examiner. So they would do deaths and also break it out by influenza. In New Jersey, for example, though, they sort of brag about no one dying from influenza. But I think Massachusetts is actually typically good at their historical records. And I have data since the 60s in Massachusetts. And I would imagine with Bridgewater State, they have some record of that.
What about the catch-all category?
Yeah, this is interesting, and we're trying to mentioned Emily Wong, who's one of the co-authors, and Brennan and I are trying to think about a sort of standalone small publication that part of the data collection process was that me, a millennial, had to call on the phone a lot of departments of corrections. And one of the things that I asked, and I have a table of every state's stated policy on racial identification of incarcerated people. I asked, like, how do you basically say that someone is what race? And every state has a convoluted procedure, but every state except for Texas claims that the way that race is recorded is self-identification. I told that to Emily Wong, and she was like, no, it's not. So there's some question about actually how it gets imputed. Michigan has races that are white and non-white. Alabama has white, black, and other. California has a list of 28 categories that are predefined that they then aggregate. So there's some states have more thought process than others behind the actual identification. Hawaii has nationalities included as race, so Hawaii will have like Korean, Japanese, Native Hawaiian, etc. So there's no I think good answer. I think that was also one of the shocks for me is what do you mean that no one has? What do you like? It's got to be somewhere. You have a system of data collection. So what is the policies behind how to actually do that in a standardized way? And I think that's a new-ish concept. I mean, people have been calling for a long time, but actually being implemented is quite like a reform is view. Yeah, thanks for the questions.
I think one of the things I was thinking about, like, in addition to like COVID, the Black Lives Matter movements, is trying to be silenced. How do you, if you have looked at how those moments where there was protests going on, how that impacted the change in disparity?
Yeah, actually, I get this question a lot, and I don't have a satisfying nationwide answer for it. So I just, in those cases, I just like go to what data sets we have. And there's some, for example, the Florida data set where you can look at charges dropped over time. A bunch of people were arrested in those protests, and a bunch of people's charges were also dropped, not universally so, but and so that typically didn't impact the population of people in prisons, but it did impact the number of people who had contact with the criminal legal system in dramatic ways like that. It would, I mean, I think one of the recruiting questions is like that's a very good question that actually can be got at empirically, I think. And I think there's more and more we're getting the data to actually do that, at least in a dozen states or so. It would be really, I don't know the answer to nationwide, but I'm interested in that.
My question was more on like similar, more on just like policies that address incarceration. I know maybe like right around the COVID, like especially in Massachusetts, there was a law that for nonviolent offenses can no longer. Like, did you account for that? Then I think similarly, like you have violent crime versus different types of crime, and I wonder if there's any information that's associated with that, and then also like, which policies are maybe having this.
Yeah, also a really good question. I'm also going to give some really unsatisfying answer to it, but so a couple things. One is that I mentioned that there were relatively few states that actually did any of the sort of things that they were saying that they would do in terms of releasing a number of incarcerated people who fit whatever criteria they made. Those criteria were often if a score a certain number on this automated risk assessment tool, which had their own layers of bias within them. And a lot of really it's like names, but you would get a score on this algorithm, and then typically parole boards would approve it or not, whether someone was eligible. And those were only in the states that did actually do these measures. In terms of, I guess, policies that had more support, could you clarify that? Support like from the public or from policy makers, or
maybe like from both, like depending on whether like, even like what are the demographics of specific populations, and then is that influencing? versus on like which population?
Yeah. So I also don't know the answer to this. I do know that if you aggregate the nationwide level, this is some of the statistics from early on where I think there is a top line way of breaking out violent crime by demographics that would also show an even higher racial disproportionality than the general incarcerated population. But that's also why these careful kind of controls need to be in place where if you compare more similarly situated people, that's when you see the actual census line. So, I mean, I think one thing that often people are surprised to hear about the prison system is that it's often 40 to 45% people in prison are there for violence related offense. And that means a lot of different things depending on the sentence, and also it's accumulated stack. But the part of this is a little off track, but part of the big 70s push to fight drug related offenses, to criminalize drug related offenses, is to open the door for them being treated as violent offenses more and more. That has actually been a little bit counterbalanced in recent years in some states. Oregon recently had a legislative session that basically overtly said a lot of these policies are racist, and like we should really think about how to have like carceral institutions not perpetuate. I think there's some, I guess, Oregon's going to take, or Oregon's going to like spread to the rest of the country, but there's some sense in which this is starting.
Thanks. I know there's more questions, but there is a class in this room right after. So I'm gonna encourage, and I'm sorry, Alex, I see you have your hand up on Zoom, but maybe you can reach out afterwards so we can take the discussion out back into the lounge. And I know Brennan's here for a bit longer, but thank you so much. Great talk and
Thank you very much.
answer.